Like a lot of other organizations, we're trying to really leverage social media because we know people live there, good, bad, or indifferent about it. That's where they are. I wrote an article that is in our recent JPE, and I also posted it back in November 2023 on LinkedIn about a 62-year-old organization that's been fighting the maternal health crisis. And the reason I wrote that was, lo and behold, there had been a New York Times crossword puzzle where the answer was Lamaze, but the clue was a breathing technique. And I thought, you know what? This is a great opportunity to set the record straight. So I think trying to give our members the tools to talk about what they do and showcase their work is something that we're hoping to continue.
This is Associations Thrive, the podcast celebrating successful associations and their leaders. I'm your host, Joanna Pineda, CEO and Chief Troublemaker at Matrix Group International. Listen in as top association executives tell all, revealing the creative and innovative ways they're increasing membership, generating revenue, nurturing engagement, and reimagining their organizations. By the way, if you've launched a new initiative, created new member services, or updated your governance structure and are seeing great results, I want to hear your story, and so do my listeners. I'd love to have you as a guest. Go to podcast.matrixgroup.net and apply to be on Associations Thrive. Now let's dive into this week's show. Today, I'm speaking with Silvia Quevedo, Executive Director of Lamaze International. Silvia, welcome to the show.
Hi, Joanna. Thanks for having me.
Silvia, tell us about Lamaze International.
Lamaze International is a 501c3 organization that was founded in 1960. We're about to have our 65th anniversary. It is an organization that represents roughly 2,000 members who are childbirth educators. Many are nurses, midwives, doulas, lactation consultants. And our mission is to advance safe, healthy birth, pregnancy, and early parenting through evidence-based education and advocacy. Much of what our members advocate for are the 6 healthy birth practices that are supported also by the World Health Organization. So that's who we are. And by the way, everybody should just go to lamaze.org to learn more.
Well, Silvia, you got to tell us what the 6 healthy birth practices are.
The 6 healthy birth practices that our members, through their individual practice or through the health center, birth center that they work at, support and promote, include let labor begin on its own, encourage walking and movement around, changing of positions. Our Lamaze childbirth educators would support birthing people bring their loved one to help support them. Generally avoid interventions that are not medically necessary. And I do want to clarify, there are some myths around Lamaze, but we would advocate to avoid unnecessary medical interventions, avoid giving birth on your back, and really encourage following your own body's urges to push. And then definitely keep mother and baby together right after delivery. It's best for the mother, the baby, and breastfeeding, that bonding, that skin-to-skin contact. So those are the 6 healthy birth practices. These are not new. They are documented in the literature as supporting healthy pregnancy, birth, and that early parenting, those early moments of bonding.
Well, Silvia, I think there probably are a lot of my listeners who think Lamaze is a breathing technique for when you're having a baby, but it sounds like Lamaze is so much more than that.
It sure is. And listen, I confess that before I was asked to serve as the executive director, I didn't know much either. I knew what Lamaze was. I was familiar with the brand and did equate it with breathing. And boy, was I wrong. One of the things that the board of directors and the members have been trying to do is educate the public on what the organization is all about. And it really is about supporting perinatal professionals across different fields. It is about helping parents navigate their birth journey, giving them the tools to promote what they want, what they need through their birth journey, working with their medical professionals, working with others that support birth. In other words, putting the birthing person at the center, not necessarily the facility, not necessarily the practitioner, but really saying, how can we be partners and collaborate so that we're maximizing the best pregnancy, best birth outcomes, and just really getting those parents and that baby off to a good start.
Well, I love all this, and we got a lot to discuss. But first, let's talk about your journey. How did you get to become executive director of Lamaze International?
Yeah, so I have been privileged to serve the organization for just over 2 years now. It's my first time serving as executive director. And so my journey has included really working at a number of organizations in the association space. It is my second career.
Oh,
I actually started out as a medical speech language pathologist. I worked for many years diagnosing and treating individuals with communication disorders, mostly adults who had had stroke, head injury, or degenerative neuro disease. So I worked in hospitals, I worked in long-term care facilities, I worked in outpatient, both here in the US and in Europe. But as you can imagine, working in that setting, while incredibly rewarding, I'm still a card-carrying member of the American Speech Language Hearing Association. I was dealing with people whose lives had been shattered. And so decided to shift a bit, became clinical faculty at 2 universities and worked with training individuals to become speech pathologists, and was very, very involved with my professional society, ASHA, and had an opportunity to start working at the organization part-time. Go figure. So that is how I got into the association space, and then just decided to grow and expand my leadership. And lo and behold, after serving at ASHA and later at another organization, here I am. That's the short version, by the way.
So what's it like to be executive director for the first time and of an organization that, by your own admission, you didn't know that much about? So what's the mental shift and what's the research that you do so that you can become someone really immersed and knowledgeable about Lamaze?
Oh, great question. First of all, it's a process, right? I'm still learning and growing and getting to know the members and really diving into the day-to-day. But I'll say for like any other first-time executive director, it's like drinking from a fire hose at times. So I definitely have leveraged my network of other executive directors and CEOs, taken advantage of everything they have to offer. Lamaze is a longtime client of Smith Buckland, a professional services company that has, as part of its business lines, association management. And so really need to say, as a first-time executive director, having the support of fellow executive directors working with other clients has been helpful. So, I'm someone that is not afraid to ask for help. I have a wonderful team. My staff is incredibly knowledgeable. They keep me going. They fact check me all the time. So I think that's helped. And I have a supportive board of directors that really 2.5 years ago said, we want to take a hard look at ourselves. We want to grow the organization. We're willing to do the hard, messy work of shifting and changing. And so that's how I've been able to move some things along for Lamaze.
Well, Silvia, what's a piece of advice that you got from a fellow CEO or executive director, say about your first staff meeting or your first board meeting? Did you get any good advice about that?
Well, the good news is in my previous roles, I had worked with boards of directors. I actually served on a board. So that wasn't as scary. The best piece of advice that I'm still trying to implement completely is to listen more not to what is said, but also to what is not said in a meeting. Someone shared that with me. I'm someone who really believes in creating environments where the team can grow, where the board can grow. I'm not someone in the association world who's looking for a unicorn. So I think trying to set the stage, trying to create a safe environment, a culture that supports innovation, experimentation. I mentioned my clinical background because I say to everybody, and this is very true, Joanna, I actually look at my work as an executive director and with Lamaze with a clinical lens, a lens to diagnosis, developing a treatment plan, implementing the treatment plan, and shifting.
Interesting.
Can't help it. It's the lens I utilize. And it's successful and sometimes it's not. So I'm not saying it's the only way to be, but that's sort of a long-winded way of saying I've been getting good advice and I continue to seek it.
Well, I was at a luncheon recently with a bunch of CEOs and we were talking about AI. And one of the CEOs said, I've asked my team, let's experiment, let's innovate. And she said, but I'm not getting anywhere.
Interesting.
And so do you have any advice for how do you actually foster real innovation? Because I think that's connected to creating a safe space.
Yeah. Honestly, I've told my team I would rather them completely mess up. And I've said this to the board, trying to aspire to something great and different than no mistakes doing the same old, same old.
So you reward people for trying to do something different.
I do. And look, I know innovation can sound like Uber, right? Well, we can't all do that. But I think in the association world, just that willingness to consider differently. One of the things that our board of directors had to tackle, like many, is rethinking membership, rethinking its models, and posing to the board simply, let's just get rid of it. And that's really hard for boards of directors.
Yeah.
And really saying to a board of directors, what would really happen if that went away? And getting the team to also embrace that mindset. And so that has led, we just launched a new, again, it's innovative for Lamaze. We just launched a new subscription for our CE. We've expanded our membership categories. The board just approved that because Lamaze board of directors and the team acknowledged we need to really get after all perinatal professionals and remind them that Lamaze is not just breathing, but really an organization that develops perinatal professionals, continuing education around labor support, comfort measures, how to empower individuals. So again, I think it is about saying it's okay.
Well, I want to dive into the membership categories because I think different associations are saying, how can we grow? So why did you expand membership categories and what were they before and what are they now?
This is hot off the press, Joanna.
Oh, okay, good.
We're expanding our student membership. Believe it or not, Lamaze didn't have a traditional student membership. And the board just said, why not? We really need to get in front of our nursing students, our doula students, our midwifery students. And so they expanded that. We also created an affiliate program so that anyone really working with pregnant people, birthing people, not just in North America, but around the world, it is Lamaze International after all. So we've expanded that. And it was a first step in sort of getting the board to think about membership, but really around engagement and affiliation. Because I do believe associations need to shift that thinking around membership if we are to grow, especially if you think about how this generation of individuals engages with their profession and their professional societies. I'm not sure that the traditional membership is really going to sustain us all. So we did get to affiliation, and then we started expanding where people are in their professional lifespan, new to the profession, new to birth work. There are individuals that, board members that started out as school teachers, but decided, hey, I'd like to get into this. So I think For a Lamaze International that's been around for a really long time, the innovation is around how can we expand and how can we think differently about who we are.
Silvia, was it a battle to expand the membership categories? Because sometimes it is with some of these societies.
Yeah, that's a great question. In this case, no. The board acknowledged this is something that makes sense. Where there are challenges and still some ongoing discussion is looking at some of the legacy programs and rethinking those, or frankly, just eliminating them. Lamaze is interesting in that it's very traditional in many ways as a 501c3. We have virtual events. We have a certification for the Lamaze Certified Childbirth Educator. We have continuing education. We have training programs. We have resources for parents. We have a scholarly journal, the Journal of Perinatal Education. A lot of people don't know that. But at the same time, we're a brand name. So we also have a licensing program. We partner with IMC Licensing Inc., and they are working with one of our great partners, which is Tomy International, a toy company. So on the one hand, we have some of those traditional features of an association, and on the other hand, we have some unique programs around licensing. So I think the board is trying to take a hard look at all of that and saying, what's next for the next 65 years?
So Lamaze is licensing the name and the brand, the logo, to toys, clothing, etc. How long has that been in place, and is it significant revenue?
It's significant revenue. As I said, Tomy International is our largest partner, and they've been with us for over 30 years, since I'm going to say early 90s. So it's been a very positive partnership. We've worked with other companies in the past, and our licensing agency continues to seek out new partners for us.
How do you select partners that would be respectful of the brand? Because you have to be careful.
Yeah, well, there's a whole process.
Okay.
We just got an inquiry the other day that we declined just because of some concerns. But, absolutely, there's a process of vetting. Like any organization has rules around who it partners with based on its mission, based on its values, that kind of thing.
Well, let me ask you another question. You said at the beginning of the podcast that you want to educate the greater community about what Lamaze does. So I guess I've got two questions. One is, why is Lamaze still important today? Why are these healthy birthing techniques important?
Well, I think you can't turn on the news, read a news article, or even look at social media with not realizing that the maternal health crisis is alive and well in the United States, especially for our Black and Brown moms, for our rural communities, for our Indigenous populations. So for a country like the United States to have dismal record around preterm births, around preventable maternal death and just morbidity, illness, it's quite shocking. As a matter of fact, the March of Dimes just issued their 2024 report card, and we really haven't moved the needle enough in the United States. So why is Lamaze important? Lamaze represents individuals who have the requisite skills and knowledge to care for birthing people, to give them the tools and the empowerment to go to their professionals and say, hey, this is what I want for my birth. And not only that, to say, something's going on here. I'm having some discomfort. There's something not right. And learn how to advocate for themselves. We hear these stories where sometimes women are overlooked. So that's why it's important. Again, we represent individuals that may work in an academic medical center. They may be a private practitioner. They may be part of a birthing center. But these are doulas, these are midwives, these are labor and delivery nurses, these are lactation consultants, professionals with all kinds of letters after their name, like the LCCE, the Lamaze Certified Childbirth Educator. And so it's important, I think, to help close the gap on some of the mortality and morbidity, especially in communities that are low resourced. We have a program called Expand Equity, where It's grant funded. Thank you, Prolacta Bioscience Foundation, for the support of that program. And donations that are provided support this program to really train individuals that are from Black, Brown, Indigenous, LGBTQI communities to become childbirth educators, to become perinatal professionals, and serve their communities. And by the way, some of these are just really low-cost interventions that have a lot of impact.
So, Silvia, how do you get the word out, right? Because I think that you're saying we got to get the word out about Lamaze. We got to get the word out about these healthy birthing techniques. And we've got to move the needle. So you as an organization, what are you doing to get the word out?
Well, this is great. Thank you, Joanna. Look, like a lot of other organizations, we're trying to really leverage social media because we know people live there, good, bad, or indifferent about it. That's where they are. I wrote an article that is in our recent JPE, and I also posted it back in November 2023 on LinkedIn about a 62-year-old organization that's been fighting the maternal health crisis. And the reason I wrote that was, lo and behold, there had been a New York Times crossword puzzle where the answer was Lamaze, but the clue was a breathing technique. And I thought, you know what? This is a great opportunity to set the record straight. So I think trying to give our members the tools to talk about what they do and showcase their work is something that we're hoping to continue. We're doing what everybody else is doing, just really trying to leverage those communications. And I think just reminding people, most people know Lamaze, but they really don't know what the organization does.
Right.
We educate, we train individuals. We're all about perinatal care.
So, did you write to the New York Times?
I did.
Did anything happen?
I wrote an op-ed piece. Not too surprisingly, it didn't get picked up. I also wrote to Parents Magazine, didn't get picked up. So I said, you know what, let's just publish it.
Interesting. I mean, I ask because I think those are things to possibly try because you never know.
Right. I'm all about that. Go for it.
Do you have a toolkit for members so that they can talk about what Lamaze is and what they're doing, and so that there's resources for them?
It's so funny you mentioned that. We are developing an updated toolkit, also a social media toolkit for our members in 2025 to help them get the word out. And as many organizations, trying to engage our members in a way to say, help me help you. The other interesting thing about Lamaze is it's a professional society, but it also acts a little bit like a small trade association in that many of our members are self-employed, private practitioners. And so we're also expanding a lot of our education around business practices. We have a workshop coming up in early December that's really focused on expanding your business. So it's interesting, but yeah, that is exactly what we're doing.
Silvia, advocacy is prominent on your website. What types of issues do you advocate on, and what does that advocacy look like?
So Lamaze has supported a lot of initiatives like signing and supporting the Momnibus Act, which is a whole package of roughly about 13 bills that make investments in social determinants of health that influence maternal outcomes. So we've been a big supporter of that. We've also supported legislation that expands coverage for workforce development through associations and credentialing and certificates. Most of our advocacy also centers around Medicaid expansion in states so that childbirth education and perinatal professionals are covered under that. That's been the bulk of our work. We've had some advocacy roundtables that have centered around certain topics. We have worked with other partners like the March of Dimes, like the doula organization. And so really coming together to say, how can we advance support for birth workers across the U.S. and especially in low-resourced communities?
Wow. Silvia, if any of my listeners know someone who's pregnant or they're pregnant themselves, what do you want them to know about Lamaze and where should they go for more information?
Well, first thing, it's not just about breathing.
Yes.
Chances are, if you're working with a midwife, a childbirth educator at your hospital, they are connected or affiliated with Lamaze International and maybe a Lamaze certified childbirth educator. So the other thing I would want them to know is we have a wealth of resources. We have online classes for parents. We have resources on our website. So I would ask them to go to lamaze.org.
Well, we will put a link in the show notes. Silvia, as someone whose 2 sons were birthed by midwives, I am so appreciative of the work that you're doing. Thank you for being on the show.
Thank you for having me, Joanna. This has been great.
Thanks for listening to Associations Thrive. We're so glad to have you here. You know, my personal mission and the mission of my company, Matrix Group International, is to help associations and nonprofits increase membership, generate revenue, and thrive in the digital space. I want to hear stories of how your organization is thriving in today's challenging landscape. Please apply to be on my show by going to podcast.matrixgroup.net. By the way, do you need help with a digital initiative? Maybe it's a website redesign, a new membership database, or a hybrid meeting that you're planning. I'd love to connect with you. Please visit the Matrix Group website at matrixgroup.net. Thanks again for listening to this week's episode of Associations Thrive. Don't forget to subscribe to the show, leave a 5-star rating, post a comment, and share it with your colleagues and friends. Bye!